You argue with me. But, because with PACU, either pre or post, it was so important that we had an accurate assessment.
Oh, yeah.
Do with,
No,
you know,
for sure. We're just kind of there as extra hands.
oh, that's cool.
This is
That's
such a
cool.
weird camera. It's really, really weird.
It's really tiny too.
I
It's
thought
like
that
the
was
goat.
microphone. I guess
Huh?
not.
No, it's this one here on that pole.
Hello, testing, testing.
No, but we definitely could have used some CNA for the transport and stuff. Because when we had to call for transporters to come down and help us bring the patient to the rooms.
Okay, they can hear us.
Yeah,
Great.
and stuff. Okay. Good. So we love with our hands, especially when we had all the tubes and everything. We had to take an ICU or take them
You can hear everything? Okay, great.
Maybe you should have a chart in your hand. Might help. Yeah. Oh, yeah, I think so. Yeah, I think the wedding is coming up or something, and I don't want to be around that, right? Yeah. Because you're really looking at me. Hello, how are you?
I'm
Hi.
good. Hi, I'm Jonathan. I'm one of the nurses here in the office.
Jonathan, how are you?
I'm good. How are you doing today?
Good.
What brings you to the office today?
Well, I was supposed to discuss with the doctor about my treatment plan.
Okay. And what kind of concerns or what is it that you wanted to discuss? Or is there anything I could
I
answer?
really want to tell the doctor I don't want treatment.
You don't want treatment?
Well, not really. So we really just want to talk to the doctor. I want the doctor to convince her to, continue with the treatment, or if there are other options for us to consider, because like she can't give up right now. Like this is not the time to give up, and I really want to talk about that.
And I want to talk to the doctor to tell her to leave me alone.
Wait, that's not gonna happen, Mom. That's not gonna happen. So.
You can see that there's a little conflict. Hopefully we can come to a, compromise. And I'll definitely bring your concerns to the doctor and, we'll go from there. Is there anything that I can answer for you guys or anything?
Well,
Well, we were talking about hospice versus palliative, and can you tell us like the difference of what would be?
So the goal of palliative is more to bring comfort to a patient when kind of treatment is no longer an option or not wanted. Hospice is more about when a patient is expected, the life expectancy is like 6 months or less.
Okay.
But the goal is both the same with both. It's just keep the patient comfortable.
that's not what I read on the computer.
No. What
I
did you
was
see?
told palliative care was more you can still have your treatment, just to make sure that I have proper management of all the pain and side effects and stuff.
And
Yes.
keeping comfortable and your pain is a big thing, managing that. And hospice is more of like the time setting.
Okay. So well, I guess that's where I want her to continue treatment and also be comfortable.
I've had treatment before.
Okay.
What about alternative stuff? We can consider that. Maybe we can talk to a doctor about anything else.
See what he
that's
knows
new.
about alternative.
Yeah, I mean, it might be different medications or, so
I've
this
read
is our
some
life.
macrobiotic diets and all this stuff. And I'm like, yeah, they ain't happening.
Well, it's, it depends on the person and we can, build something individualized for her. We'll see. I'll bring your concerns to the doctor, so let me go talk to Dr. Ann.
Okay, thank you, John.
Thank you.
to visit Counter-Search too. And we come out and say too, with him and the dog. She probably just looks to the kid, so. And then we're talking about this. So how much longer before you start? Summer? Wow. That comes actually easy. When will you get a note like saying that you made it or not? March. Then they all go out, right? Yeah. Mm-hmm. To find a place to live and everything. So vacation. Yes, good.
Sometimes I haven't had a vacation in like 6 years.
I was gonna say, it's been a long time.
For a while. So, well, I've had little vacations here and there, but always like stress. I have to study,
This
I have to
exam, this
discipline,
exam.
yeah, for residency.
So you've done all your exams?
There's like one licensing exam left, but that's if you do have to do residency, but I want to do it now.
Mm-hmm.
So I will probably study for it after March.
And they pay you during the
But it pays in like,
Yeah, I know.
things like cover my tuition and
Mm-hmm.
just keep me alive.
Basically just a teacher.
Yes?
Hello.
Hi,
Hi.
Mrs. Conti.
Hi, how are you?
I'm Dr. N. How are you doing?
I'm doing fine.
Yeah, you feeling good?
You're ice cold.
I'm so sorry. It's genetic. My grandmother has cold hands. I'm so sorry.
It's warm heart, that's okay.
Yeah, okay.
We'll go.
So what's going on? How are you
Well,
guys?
I know we were talking last visit that my cancer came back,
Okay.
and you gave me some treatment options, but I've decided not to have any treatment.
Okay. And you don't want treatment?
I don't want treatment.
Okay.
But
is there
we
any
really
issues
wanna,
with that?
yeah, I think I came just to make sure that we discuss other alternatives.
Okay.
You know, I think it's too early for her to give up right now.
Mm-hmm.
I have a wedding next year and she has to be there, so
Okay.
I don't understand why she's like being so stubborn or,
Because I've had this treatment.
okay,
And
but
then you visited me and I see you. I don't want it to.
I remember that and I don't want that for you
You were
either.
young, you were young.
Okay.
You're gonna go through that again?
Okay, I mean, I completely understand where you're coming from, because you would want your mom to be at your wedding,
Yes,
and I
yes.
understand that, but, Mrs. Conti, she's able to make a decision on if she wants treatment or not, depending on how she's feeling about the treatment. We're gonna try to work with both of you, so you guys are both okay with moving forward, but ultimately, the decision is Mrs. Conti's to make.
Yes, but I think it's your job to let her know about, you know, the different options that she's available.
The treatment they're talking about is gonna make me sicker than the first time.
Okay.
Is
I
that
don't wanna
true?
do
Like,
that.
is there anything else we can use?
Okay, well, the treatment, that I did discuss with you, Mrs.
I mean,
Conti,
that's
will
kind
make
of
you
heavy
sick.
duty. I looked it up on the computer. It's
Okay.
very heavy duty treatment.
Okay.
I was in the ICU last time with no white count, almost dying. I don't think I don't
We
wanna
can
do
definitely
that
look
again.
into, other options, I can do some research and look into other options, and maybe we can discuss that and see if that would be something you'd be interested in, Mrs.
But
Conti.
we were trying to ask the nurse, what's the
Mhm.
difference between palliative care? I know what hospice is. Hospice, friends of mine have been on hospice and died 2-3 days later.
Okay.
What's palliative care?
Well,
What does that include?
well, it's just a way to make you comfortable, and kind of remove pain from your sensory abilities while you're going through this period of treatment, or in the stage of the disease that you're in. We just kind of want to keep you comfortable, and so that you're not
So
in
your
pain.
palliative care doesn't do anything for my cancer?
It's not aimed towards a cure, it's more just comfort measures.
Yes,
Till generally the end.
Right.
Okay, well, I'm not taking her to her deathbed, is that what you're saying? Like, yeah, I'm not doing that.
So we don't want to give up on you, Mrs. Conti. But if you
But
feel like
I've had friends of mine that have had cancer. They're 10 years and they still have cancer.
okay.
The treatments that they're getting, they're able to live with. They're not these chemotherapy treatments that they're vomiting their heads off and doing that. Their cancer hasn't gone away, but they've been alive for years with this.
Okay.
So what's the difference? And why can't I have something like that? Why do I have to have such aggressive treatment that's gonna make me so sick that I may not make it to her wedding anyway because of it?
Well, Mrs. Conti, your cancer is a little bit more aggressive. That's why the treatment is so aggressive. In order to try to target the cancer cells and get rid of them. That's
Mhm.
the only reason why it's so aggressive. We can try to look into other options, maybe decreasing the dosage. I'm not sure. I would have to go look into that and give you a better response and on changing the course of treatment, so you can make that decision when you see all options that are given to you. We can look into
Okay.
that.
What about alternative, like anything not chemotherapy? Can we like try anything else that will make her feel better?
Well, not with her type of cancer. There's not any alternative treatments that will fight the cancer, but we can make you comfortable and take away the pain, maybe give you pain meds
Is
so
there
you're
anything
able
just
to.
to stop the cancer from growing and just, kind of leave it there?
Not right now, but research might come up with something better. But at this moment, what we do have to fight your cancer will have side effects, and it might make you sick. It might not. You might not feel good.
I mean, I
During
know a
that
friend of mine
time.
who has breast cancer. She was told it was very aggressive, but she's living more than 5 years with it.
Well, everybody responds,
She's not getting chemotherapy right now.
Right.
everybody responds differently to treatment. So it's very individualized and it depends on the person.
Mm-hmm.
So, really it's ultimately, right, doctor, her decision
Yes.
on,
Is there anybody else I can consult on what new treatments are out there?
I can give you some information on other doctors who do more natural remedies. If you wanted to look into something like that, I can look into what may be out there and maybe suggest something to you, and then that would be ultimately still your decision to make to get out of the treatment that we have right now and go
It's
into
just,
that.
in respect of my daughter, I
Mhm.
don't mind the treatment, but if the treatment's gonna make me sicker than I feel right now,
Mhm.
it's not worth it to
Okay.
me. And like I said, I go to a support group, there's other people there with cancer, they're on treatments. No, is their cancer gone? No, it's never gonna be gone.
Mhm.
But they're living a somewhat normal life.
Yeah.
They're enjoying their grandkids, they're doing those kind of things, which I would love to do.
Yeah, and I want her to see my
But
kids.
I also don't want to be back in ICU with no white count, fever is extremely high, tubes coming out of everywhere. That's not life for me, and I'm not going to do that again.
Okay, I totally understand, and I would want you to see your kids too. Maybe we can look into palliative care. I can maybe give you some brochures so you can read up on it and see exactly what it's about. And if that's something that you're okay with, then maybe that's an option that we can explore.
Or I'd like a choice of options. I'd like to
Mhm.
see, some type of a menu of like, okay, choose one from A and one from B. Not that it's a Chinese buffet, but
Right.
I just feel like this is the only option you've given me.
Okay.
I know I'm not going to do it.
Okay.
But I also, like my daughter says, I'd like to be there for her wedding.
Mhm.
I'd like to be there when she has a baby.
Mhm.
But I also know that I'm not going to have my kids, my grandkids, or whomever watch me in an ICU with tubes coming out of everywhere for no reason because it's not going to get any better.
Okay, that's understandable.
I
So
mean, I've had this cancer for a long time anyway.
okay, so I can give you a few options on what is out there for that kind of care and long term. So you can see what is out there, and we can discuss it after you've read it, what you think you would want to do. We can kind of find a good fit for you if that's truly what you would like to do.
I'd like to do something more like that.
Okay. Okay.
Because I went through the aggressive treatment. I did it once. I gave it its chance.
Yeah.
And now here we are back here again.
It's really difficult. So I understand completely where you're coming from. So I will definitely look into that. I will go get some brochures for you.
and
Maybe
I'll help
Jonathan
with
can
that.
help.
I can go over all
Grab
that
some
stuff with you.
Brochures,
Yeah, we
so
appreciate
we
that.
can
Mhm.
you can take a look at those.
Okay.
All right.
I'd like to have some options, and then we could discuss it with everybody in the family.
Yeah, okay. Yeah, we can give you some, before you leave today, we'll
Okay.
give you some brochures.
Okay.
Outside of
fine.
that, is there anything else that you guys would like to talk to me about? Okay. When is your wedding?
It's next year, so, you know, you can tell my frustration that she's refusing this right now and, she
Well,
has to
we'll-
be there.
You can take my picture there, it's
Okay, well,
Bring
she's
my
being
picture.
stubborn, she's being very stubborn, and it's upsetting. It's
I know, I can imagine.
How
But we'll
upsetting
find
was it when
something.
you saw me in Mexico?
It was very upsetting, but
Okay.
it's,
Well, I think we're past that now, and I'm
Yeah.
glad we broke some ground here, and we're going to more of the options, right?
Yeah.
That's a positive.
Right, yes, that is positive, Jonathan, that's very positive. We'll find the best fit for the whole family, and
Okay.
hopefully everyone will be good,
yeah.
you especially, yeah. Okay?
Yeah.
Thank you guys for coming
Appreciate that.
in.
Yeah.
Thank you.
Thank
Have a
you
good
for saying
day.
that. Thank you, Ron.
Let's go get that stuff.
Yeah, let's, yeah.
Before you
wrap it.
guys leave.
Should we
Yes,
like
we'll-
stay here?
Yeah,
or-
just wait right here, and Jonathan will bring it back in for you.
Okay, alright, sounds good.
Okay,
Oh.
thank you.
Go get that.
It's on your mind anyway. We done?
Good.
Okay, Lou, talk to me. I thought palliative care was to kind of keep everything under control, because he kept going back home. Are we off now?
We're a team, guys. Yeah. And I'll give you also as a resource for you. I'm gonna go for it. It's okay, you have the knowledge.
Okay, great.
We're ready to
Go ahead and
go?
put his headset on.
Are we ready to go? So we have to call the doctor. Yes, Dr. Flynn is coming. So that's when you're gonna speak with that Lindsay called you, and the physician, there's a little.
Yeah,
she said she's doing Dr. Nancy to see the doctor.
You just state that you're and you can be
I like that thing. There's a DJ with very charms of doctor's outfit. Really pretty.
Oh, it may not be on to save the battery. Let's get it up.
No. This is where this is at.
Mm-hmm. Blinking with no communication. Yeah, you're good. Yeah, but he didn't respond, you can't hear him?
I didn't.
Go ahead, pass it over to you.
and then I'll check with Mariana to see if he's recording.
Okay.
He said he was gonna let me know.
Okay. This is at 4 o'clock.
Okay. Okay. Here we are. We're going to be reporting you guys. So your patient name is Stephen Mallory. Okay, so I'm giving a report. Your patient is Mr. Stephen Balrit. He's 67, male. Height and weight is 6 foot, 280 pounds. Allergies to penicillin. He's a full coat patient. And patient chief complaint is shortness of breath. Stephen Balrit is a 67-year-old obese Caucasian male with 10-year progression of severe right knee arthralgias from osteoarthritis. No relief after multiple trials of high-dose non-steroidal anti-inflammatory agents, including phenylbutazone, disalcid, and most recently Celebrex. Despite physical therapy and prior use of a knee brace, situation has deteriorated. Presently, pain significantly affects his ability to ambulate. Now able to walk only by cane. Joint pain is asymmetric. Past medical history, acute coronary syndrome, 2 vessels PTCA related to a non-ST segment elevation, MI, 6 months ago. Hypertension for the past 8 years have been well controlled on therapy. He has osteoarthritis for the last 10 years and major depressive illness for the past 4 years. His medications are currently Lopressor or metoprolol, 25 milligrams BID, lisinopril, 5 milligrams BID, hydrochlorothiazide, 12.5 milligrams QAM, atorvastatin, 10 milligrams QAM, Bayer's aspirin, 81 milligrams QAM, Selecokid, which is Celebrex, 200 milligrams QAM, Venlafaxine, which is Effexor, 150 milligrams daily. Social history, he's divorced, retired construction worker, and he lives with a girlfriend. Vital signs, blood pressure 110/80. His heart rate is 130. Respirations are 22. Temperature 98.6 Fahrenheit orally. SpO2 is 92% on room air. And he has pain of 6 out of 0 to 10 on numerical scale. And that's it. Got it?
That's a lot. Oh, no, could you repeat the medication dosing, please?
Yeah. So it's going to be Lopressor or metoprolol 25 milligrams, lisinopril 5 milligrams BID, hydrochlorothiazide is 12.5 milligrams every morning, atorvastatin 10 milligrams QAM, baby aspirin 81. You got it?
Mm-hmm.
All right, excellent. All right, thank you. Okay.
Ready?
One second, sorry. IV fluids, normal saline, 50 milligrams, milliliters per hour with PCA pump, patient control anesthesia pump, and that contains morphine infused at 1 milligram per hour with a 2 milligram bolus, PRN for pain.
I'm sorry, how many? 1 milligram per hour?
With a 2 milligram bolus, PRN, for pain.
So any standby order or anything?
That's it, that's all I have.
Yeah.
Oh,
Okay,
patient is complaining of shortness of breath.
okay, so
There's no oxygen.
no oxygen going
He's gonna need oxygen.
how many days?
He's gonna need 2 liters
That's
so,
all?
until we can put it up to 295. And we have to maintain it at 95 or 200. Where are the orders? Oh, these, okay, yeah. So the person,
What's the normal procedure?
Why are the meds up there like this? Are we supposed to pretend that that medication is just sitting up there?
What is that medication up there?
So I'm like, I mean, we don't give pills, we don't know what they are. Let's get started. Okay.
okay, so we go outside?
You can, yeah.
We just need to get
Next is 60 to 70 seconds. Well, let's try that.
Good afternoon, Mr. Stephen Bowdre. My name is Salson, and I'm going to be your nurse for today. This is my team. We're going to be assisting you today.
Hello, I'm Deepa and I'm a charge nurse of the week today.
Hi, I'm Lindsay. How are you feeling today? I see that you came in with shortness of breath.
Oh. Okay,
So you, yes, can you, can you please give us your first and last name and date of birth, please?
My name is Stephen Baldry. My date of birth, 1/15/51.
Okay, and I see that you came in, what is your date of birth again?
1/15/51.
Okay.
Hard to breathe.
If you're having a hard time breathing, okay, we're going to be giving you some oxygen.
Okay, that's why I first
Okay.
called oxygen.
Do you have any chest pain?
No, just can't breathe.
You just kind of getting oxygen.
Okay, so I have another cannula.
Yeah.
no, it's okay.
Okay, I'm giving you some oxygen through nasal cannula. 2 liters. This is gonna help you like breathe a little bit. Right?
I'm also gonna listen to your heart and your lungs, okay?
Okay.
Okay, I'm going to be putting this in your finger just so we can monitor your oxygen.
That sounds good.
Okay, I'm doing it.
Okay, so the pulse rate is 136. Pulse is 94%. Pulse rate is 132 right now, so please stand by or we have. Oh, it's a recharge. No, I was reading at the stick. It's a recharge.
This is oxygen.
Yeah, oxygen saturation. Okay.
Mr. Bolton, are you getting any, do you feel any air coming through here?
Yeah, but I'm getting scared. I wonder what's
You want
happening.
different blood pressure?
Do you want
I
a blood
keep
pressure?
breathing faster, but still feel like I'm not getting, there. Kinda hurts my chest
Your chest is hurting?
when I think I should breathe.
Can you point to where it's hurting?
it's like inside my chest, but
Inside it hurts.
mostly on the left side.
Can you describe the type of pain?
I don't know, it feels like there's something heavy
Heavy?
inside my chest.
Heavy pain? Okay. We just sent one of the nurses out to go get the doctor.
Yeah,
To have the doctor come in here and look at you as well, just to calm you down a little bit and make you feel a little bit better about what's going on.
maybe we can look at the more.
You want the better one?
Yeah. Just a bit.
The red part?
Even with the nasal cannula oxygen saturation is still 91%.
Can we titrate it up or no?
How much is it at right now?
Is that two?
On our physician order right now, we have only 2 liters, so Sujan just went to get the doctor. Maybe we can call.
I'm getting scared.
I'm right here, Steven. I'm holding your hand, okay?
I'm scared.
Try to just concentrate on your breathing. And we're gonna get this. Oh, here we go. The doctors are here, okay?
I've been trying.
Okay, so oxygen
The
saturation
patient's
is
right.
91%.
Give her a name.
Yeah.
Hey, Mr. Burry, we're here to help.
So we didn't even get the blood pressure?
Yeah, so we got an EKG. What seems to be a problem, Mr. Burry?
I'm sorry, what was the question?
What's the problem? What are you having difficulties with?
Just having difficulty breathing. I was just laying here and it started. Just getting scared.
He said
Okay.
it feels like crushing pain on his chest, and he's having a hard time breathing. His
Okay.
oxygen was at 91 a little bit ago. We're at 2 liters right now.
Okay. Do we have an EKG? Can we put the leads on?
Sure.
Is he cardio?
All right, Steven, I'm
We don't have
gonna
it.
just open this up a
Do we have
little
a
bit.
pulse?
The pulse is 132.
Did you give him fluids?
Yes.
Yeah, did you
He
give him
he has
fluids?
here on IV fluids right now.
When did the shortness of breath start?
Oh, shoot.
Yeah, it's just
Are there
like
things
5
on there?
minutes ago.
5 minutes
Oh,
ago?
perfect.
Okay.
Thank you.
Well,
I think we should give him some. I think we should give him some basic pressures because blood pressure dropped a little bit.
yeah, well, let's check the heart rate.
I feel like I'm not getting well. And
Can we get him on a non-breather mask or change the, instead of the.
Yeah.
We should keep close to it. Okay. Alright, we're connected. Yep. What are we doing? EKG? That's it. Something wrong with
We should do the, what's it, synchronized
Close.
cardio version since his blood pressure so low.
Is it all good? We're gonna change the mask just
No,
to
no,
get
it's
more
not.
oxygen,
The
okay?
heart rate is at 160.
This will help get some more.
It has to be,
Oh, we're
above
looking.
the, okay.
So do you want it in our
Can we do
chamber?
it,
See, that's it. Which
Can
man
you
is
feel the
it?
air?
I was just
thinking
of
albuterol,
yeah,
to help the shortness of breath, but it's
Okay.
even on higher or anything, or is he normal?
I mean, he's
This is-
normal.
yeah,
No, we
It's
just,
just he's tachycardia. Okay, so we just wanna slow his heart, yeah?
Yeah, I'd say give him epinephrine.
that's what we
Yeah.
said.
Wait, epinephrine does
no, no.
That would
no,
increase heart rate, we want a slow heart rate.
No, we wouldn't do it.
Because he has a pulse, I don't know if you ever got a pulse.
What were the medications that were
Give him a
given him?
vasopressor.
I think he had the blood pressure medication to the morning. Blood pressure.
You don't wanna have my emergency.
Now, can we like, run some labs? Can we check his, basic, chemistry panel?
Can we give him Cardine? Since his blood pressure, 138, I'm sorry, can I see the blood pressure?
ABG, CBC, Chem 7?
Blood
Okay,
pressure
so
is
we
very
got
low
it.
like right now.
You want to see that?
Yeah.
It's better than 130.
What is the blood pressure right now?
Blood pressure, it's low. Is
96
96
over
over
75, so we cannot give any response.
Okay, so since it's 96 is, okay,
We can't, like, yeah.
You can't give him anything.
Are there any abnormal labs?
No. Just book or price.
What are
One
the,
fifty.
what are the EVGs? What's going on?
It's like
It's a lot of acidic.
He's acidic?
On the low
It's trying to
normal,
make it
but it's probably because
What was he doing before?
Yeah, what was he doing before the shortness of breath?
He was just laying here.
Okay.
Steven, you weren't doing anything when you had a shortness of breath? You were just laying here?
Yeah, so
What's his
his
past
troponin is
medical
elevated. It's at
His
1.5,
past medical
so
history.
What was that?
He had
troponin.
hypertension for 8 years. He had an MI 6 months ago. But his troponin also had an acute coronary
And his
syndrome.
GMP is also
He
elevated
has
at
hypertension,
200.
but it's controlled. He has depression
He's
4
what?
years ago.
EMP.
For 4 years, and he also has osteoarthritis.
So it's got heart failure. That's the one I'm
But you had a recent MI then. Oh wait,
Yeah,
that's
but
right. That's
I'm
he
not-
had one 6 months ago.
okay.
So do we
Yeah.
get a D dimer? Well, I don't know if we can send
Yeah,
you.
we should. He was just having like sudden pain. You
No,
know,
we-
with chest.
So can we start him on a
How long has he
heparin
been
drip?
sleeping in this
that's
bed?
I think we should start on heparin drip. That
Well,
would hurt.
Start him on a heparin drip?
What's the PT on him?
What's his?
Did we see his PT? Was that
It's
drawn?
not.
The results need to be in order.
That's a low molecular weight.
yeah, proton.
Oh, okay.
Oh.
I see. That would be under the,
I read you something.
oh, here, PTT.
No, that's fine.
I don't think
There's no.
yeah,
Well, it's usually we have to put him on a heparin.
Can we get him on like albuterol or something? Can we listen to it? Yeah, we can listen to it. Something
Yeah.
y'all listen to it. Song. Do you? I don't have my
So
stethoscope.
here, right here.
Oh, I can.
I'm gonna put him first.
Okay.
Listen to him first.
Okay.
These heart failure. So is his bed's
Okay,
fine.
Miss,
Good.
we're gonna sit you up so we can hear your lungs from the back. Is that okay?
Okay.
It should be given some
Oh.
advice. Or not,
Did we
really,
do
what
it?
can you
Did we check? He uses a brace because of his osteoarthritis.
Oh, this diminished on the right, right.
What is this?
Lower.
Did you guys
So
do
do
an
we know if
inspection?
have you traveled recently?
No.
Okay, let's do.
an
We're gonna
inspection.
do. We're gonna do full head to toe
Okay.
inspection.
Yeah.
Alright. Okay, I'll do an inspection. I'm gonna inspect you now.
Did you get the inspection earlier? Can you tell us what you found?
No, it's okay. We can do it now. Go ahead, Fatty. We can do the. We'll do the. You want to do upper and we'll do lower?
Sure.
Okay.
So, it looks,
So when
Mr. Stewart, we're gonna look underneath this bandage.
Yeah, what is this, a surgery?
he has a brace on because.
Oh, he had arthritis or something like that.
It
Yeah,
just
but
looks like
it's
that.
bleeding. It looks
Like the toe.
I think
space.
it's
Do they know that we started, can we start the
Oh, so this is the one that's.
Oh.
CBC. Oh.
Nurse,
Did
do
you have
we
a
start the
recent surgery?
heparin?
What
Did you have a
happened?
recent surgery,
Low
Mr.
molecular
Ball?
weight heparin drip? Do we start that?
No, we didn't start yet.
Yeah, can we do that?
Knee replacement.
What do you tell?
I don't think
Knee
we
replacement of
I don't think
what?
you should.
So it's most likely it's a PE.
Yeah.
Yeah, that's a demobilization. So yeah, we definitely want to do the heparin first and then the warfarin, and we can test for D-dimers.
Yeah.
To confirm that. That's what we want to do.
Mm-hmm.
What are we gonna put the heparin with on?
Oh, like 20 minutes.
So we didn't learn that. So you guys
know
know?
that.
Alright, heparin drip.
We have not learned it at all.
Do we have anything on in the chart? Probably not.
Is that what they asked?
I mean, because if we're doing a drip, we have to know
The
where the
target and range.
Mm-hmm.
Okay, phone's up to date.
I don't have heparin here.
Does anyone remember?
No, that's
Do
fine.
we have to put
Maybe
them
we
into
can
the
start
CT
putting
scan
on.
or not?
Sorry, what was that?
Maybe we can start putting all the heparin drip back.
We can prep it before we get the dosage? Yeah, let's do
Yeah,
that.
let's do the make.
Do we do a basic lesson?
Should we get the heparin on the fresh chart or?
No, no.
No,
I'm
there's
just
not.
checking to see if it's there.
It should be, maybe the first floor.
So how much fluid is he getting?
He's getting 50?
An hour?
Yeah.
Oh.
50 milligrams an hour.
Then,
Okay, it's going up now, that's good, I'm taking these, good for 10. It's usually small. Should I just pretend it's a
Oh, never mind.
Okay.
We have to go to a different IV line.
that would be, you said in the policy.
Does he have any allergies?
Yes, to penicillin.
To penicillin, okay, I just wanna make
So
sure.
I think so, right now.
What's his weight?
280 pounds.
210
pounds.
What is it?
280.
No, I don't think I have any allergies.
He doesn't have allergies.
No, we have him double as penicillin.
Oh, yeah.
I'm
Yes.
allergic to penicillin.
Okay.
Yeah, that's what it is.
Okay.
There was some medications on your general surgery. What about just for
That's it.
Did you not take the medication?
5,000 units?
Yeah, were these your medications from this morning, Steven?
Yeah, 5,000. Or 80 per
Did you take your medication today or no?
10,000 units, since he's
I don't know what they have here at the hospital, but
These were-
I can tell you what I take at home.
He's heavy on
No, do you see these?
How do you know?
I just found these on the table. Was this from
Okay.
earlier
The number
today that they
would be
didn't give to
Yeah,
you?
I'd say 10,000, give him 10,000
Sorry?
units.
I have these medications that I just found on the table over here. Did the nurse earlier give this medication to you, but you did not take it yet?
Yeah.
No, I haven't taken anything yet.
You haven't taken any
Are we
medication
supposed to
yet?
dilute that one?
Yeah.
That's like 10,000 units?
So we're missing.
Yeah,
one.
that is what I said.
Because I think it's gonna be diluted 10,000 units, it's not direct 10,000 units of the current.
Sure.
Yeah.
10,000.
Yeah.
Okay, diluted is
Right,
fine.
right.
Diluted will make sense, but like direct, apparently
Okay,
10,000.
diluted is fine.
No more.
Okay, maybe we can confirm on that one because we like hang on.
Confirm
Yeah.
with
Okay, simulation is over.
Okay.
We don't even know if let's go back to 232, 235.
It's not safe.
Okay.
What happened?
We're
We're done. Did we fail? He didn't die.
Yes, he did. He's
It's
blind.
fine. Look at his. He actually. His
No,
blood
he
pressure's
died.
going up. He's fine. Oxygen's 95.
Oh, I feel like I died with him too.
Right? We're all like.
Don't worry, we take care of that. So just
We talked to amongst ourselves because we were comfortable, but I tried the cross. Hopefully did it better. Well, that was fun, right? We're all like, oh my god.
But they were trained.
I mean, we were trying. But they had assigned roles. We like amongst us. We